Did you know that 1 in 4 adults skip their recommended screenings and tests? Today, we're talking about why it's important to catch problems early and how you can make sure you are not one of those adults who skips these important appointments. I'm here to help you live a life of health and freedom from addiction. And let's face it, nobody wants to schedule doctor visits unless they have an issue. But the truth is that regular health screenings are essential to maintain good health and catch potential problems early when they are easier to treat. Let's start by setting up a routine. Just like we brush our teeth every day to prevent cavities, we need to see our healthcare provider regularly for checkups. During these visits, providers can detect issues before they become serious problems. They can measure our blood pressure and check our overall health. For adults under 65 who are in good health, this means a checkup at least once a year. For those over 65 or with certain health conditions, it may require checkups twice a year. You should also schedule specific screenings based on your age and risk factors. There are several types of screenings recommended by the United States Preventive Services Task Force. These include screenings for conditions such as high blood pressure, high cholesterol, diabetes, colon cancer, and depression. For men, screenings may also include prostate cancer and testicular cancer. For women, screenings may also include breast cancer and cervical cancer. It's important to note that some cancers don't have symptoms until later stages, making regular screenings crucial for early detection. If you're wondering which test you should get and when you should get them, don't worry. We've got you covered. You can find a list of recommended screenings and the frequency of testing on our website, healthy.org. Don't forget to stay updated on all your vaccinations as well. Vaccines protect us from serious diseases, and some diseases can be spread through sexual contact. Staying up to date on vaccines like the HPV vaccine can help prevent infections from occurring in the first place. So, what should you do if you're worried about sexually transmitted infections? First, it's essential to practice safe sex by using protection and limiting the number of partners you have. Being open and honest with your partner about your sexual history and any concerns you may have is also important. If you think you may have been exposed to an STI, it's important to seek testing and treatment right away. Untreated STIs can lead to serious complications down the road. Also, don't forget to get tested for HIV and AIDS, even if you don't show any symptoms. Many people who have HIV don't know it because early symptoms can be mild or non-existent. Early detection and treatment can help prevent further health complications and allow for better management of the virus. Certain risk factors can increase the likelihood of developing STIs, so it's essential to be aware of them. These risk factors include having multiple sexual partners, having unprotected sex, having a partner who has been incarcerated or uses injection drugs, and having a weakened immune system due to certain medications or health conditions. It's important to note that anyone can get an STI regardless of sexual orientation or gender identity. So please take care of yourself and your partners by practicing safe sex and getting tested regularly. Now let's talk about what to expect at the doctor's office during a routine visit. Your first visit will involve your provider asking you several questions about your lifestyle, diet, and exercise habits, as well as any medical conditions or medications you may have. They will also perform a physical examination, including checking your vital signs, listening to your heart and lungs, and examining any relevant areas based on your concerns or risk factors. Depending on your individual needs, your provider may also order blood tests, urine analysis, or other screenings to assess your overall health and detect any potential issues. Once the results are available, your provider will review them with you and discuss any necessary next steps. This may include additional testing, a referral to a specialist, or changes to your diet or exercise routine. It's important to remember that your provider is there to help you maintain your health and well-being, so don't hesitate to ask questions or express any concerns you may have. For example, if you have a family history of a particular condition, Let your provider know so they can take the necessary precautions and conduct appropriate screenings. Similarly, if you have recently experienced a significant life change such as the death of a loved one, a move, or a new job, let your provider know, as this information can help them assess your current health status more accurately. Your provider may also ask you about your mental health during your annual visit. Conditions like anxiety and depression can significantly impact your overall health and well-being, and it's essential to address them promptly. So don't hesitate to be open and honest with your provider if you're struggling with your mental health. And don't forget to follow up after your appointment. If you have any further concerns or questions, don't hesitate to reach out to your provider's office for clarification or additional support. By being proactive and engaged in your own health care, you can help ensure that you stay in good health and catch any potential problems early on. Now let's move on to staying vigilant about your family's health history. Knowing your family's health history is essential to understanding your risk for certain conditions and making informed decisions about your health. Your family's health history refers to the medical conditions and diseases that have affected your relatives, such as your parents, grandparents, siblings, and children. Start by creating a family health tree, or a list of your family members and their medical conditions. This will help you identify any patterns or trends in your family's health. Certain conditions like heart disease, stroke, diabetes, cancer, and mental illness can often be hereditary. By understanding your family's history, you can be more proactive about managing your health and preventing or delaying the onset of certain diseases. For example, if you have a family history of heart disease, you may want to focus on maintaining a healthy diet and exercise routine to reduce your risk of developing cardiovascular disease. Similarly, if you have a family history of diabetes, you may want to monitor your blood sugar levels more closely and take steps to maintain a healthy weight. If you discover that you have a family member who has had a condition that you're concerned about, don't panic. Instead, use this knowledge to take positive actions. Talk to your healthcare provider about your family's health history and ask about genetic testing options. Genetic testing can help you understand your risk for certain conditions and allow you to make informed decisions about your health. By understanding your risk for certain conditions, you can take steps to prevent or delay their onset. For example, if you're at risk for breast cancer, you may want to consider getting a mammogram or MRI screening more frequently. Or, if you're at risk for colon cancer, you may want to undergo colonoscopies at an earlier age than the general population. Remember, knowledge is power. The more you know about your family's health history, the better equipped you'll be to take control of your own health and make positive changes that can improve your overall well-being. Stay proactive, stay informed, and prioritize your health today for a better tomorrow. That wraps up today's video. Check out these other videos for more health tips and information. And don't forget to subscribe to our channel for new videos each week. Thanks for watching.